guys. In this lesson, we just want to review a little bit about pediatric vital signs, just the highlights and important points. So for each of these, in your outline, there's information about normal values, techniques on how to get these specific vital signs. Now, the normal temperature in kids is the same as adults, but it's important to know that the most accurate temp in the child is usually a rectal temp, especially in kids up to age 2. Now, we don't always do rectal. A lot of times we'll do axillary. Just know that what you can't do is oral in children under 2. They're not really going to be able to hold it in their mouth. Now, up to age 5, again, we usually will use axillary. And then after that, we can switch to oral as long as the child can tolerate it. So on this thermometer, I want to show you a cool little feature that some thermometers have. So if you have it, you'll know what it is. It's this little stopwatch here. So this little stopwatch will actually beep after like 15 to 30 seconds. Everyone is different, so just find out what yours does. You can actually use this to count like respirations while you take their temperature. Pretty cool, right? So pulse rates in kids, that is how many times their hearts beats per minute. So it varies by age, and we've listed those in your outline. Just know that by age 10 or so, it's really closer to adult vital signs. So it starts a little higher and it starts to come down until it's a little closer to what adults are. So for littles, the most accurate pulse technique is actually to listen to the apical pulse for a full minute. These guys usually have super, super fast heart rates, so it's really hard to count. So better to listen for a full minute and make sure that you get it accurate. Now, if you don't have a pediatric stethoscope, that's okay. Just use the bell of an adult stethoscope since it's smaller. Now, in kids, we can also use a brachial pulse, which is found just inside the elbow. But again, as kids get older and older, they're more and more like adults. You can move to that radial pulse if it's easy to feel. And as their heart rate gets a little closer to adult, it's easier to feel as well. So with respirations, again, the normal values will vary by age, so check out the outline. But one important thing to know here is that kids may be belly breathers. So you may actually be watching the abdomen rise and fall instead of the chest. You also want to look for retractions. This is when their chest actually goes in during inspiration instead of out. So that's not good. That is a sign of labored breathing. No matter what you do, though, you want to count the respirations for 30 seconds at least and multiply by 2, or you can count for a full minute and make sure that you're getting an accurate number. Especially the younger kids, their respiratory rate starts really high. It's usually easier to just count for a full minute to make sure your number's right. And again, you can actually count the respirations while you're taking their temperature or while you're taking their pulse, because especially in, older kids and adults who understand what's going on, if you tell them you're counting their breaths, they will breathe differently. So if you can count while you're doing something else, you kind of trick them. They don't really know what they're doing. Now, the technique for taking a pediatric blood pressure is exactly the same in an adult, so make sure you check out that lesson. But the big thing to note here is that you have to have the right size cuff. Same rules apply. Check the range lines, make sure the cuff's the right size. Now, we all know kids can get squirmy, so sometimes you'll have to hold their hand or hold their arm still. And you can even tell them something like, the cuff is just going to give your arm a big hug, makes it a little less scary. So check out your outline for normals and the adult vital signs lesson for techniques. All right, let's talk pulse ox. Kids love the pulse ox. Basically, it's a shiny red light. So make sure you let them play with the red light. Now, sometimes in peds, we also may have the little sticky ones. So you can tell them it's just like putting on a Band-Aid. So especially if they're not feeling well, you can kind of say, I just want to put a Band-Aid on and make you feel better. So either way, you may just need to hold their hands still while you're checking just to get a really good waveform. Always have the caregivers help you out with this one. Lastly is pain. The scale that you use for pain is entirely dependent on the child, honestly. So nonverbal younger kids, you're going to use the FLAC scale, and there's a cheat sheet attached to this lesson for that. But if they're verbal, but may not yet be able to actually comprehend the numeric scale, you can actually use the Wong-Baker Faces scale and have them tell you which face looks like how they feel. You can also kind of just look at their face and tell, but the scale itself is designed for a child to choose a face. So make sure you're using that correctly. And of course, with the older kids who can conceptualize and understand it, you can use a numerical standard 0 to 10 scale. So I just want to give you a couple of tips and tricks for taking peds vital signs. Being in a doctor's office or a hospital can be really scary. So we want to make it fun. We can make a game out of it if we can. The same thing with peds assessments. You can tickle their tummy while you listen to their heart, lungs, and belly, right? We also want to be honest with them, but we can relate it to something they can understand. Like I said, giving their arm a hug or putting on a Band-Aid. Sometimes that helps take the fear out of it. Also, involve the parents or caregivers. This is so important. As you can see here, the mom is holding the baby, and that's so helpful because it keeps them comfortable and they feel like they're safe and comforted. Just don't force a child into a certain position or force them to do something. Just make sure they feel safe. That helps build trust. And the big thing with building trust, you never want to tell a child, this won't hurt, especially if it will, because that is the quickest thing that is going to lose you trust with that child. All right, guys, make sure you check out all the resources attached to this lesson and check out the pediatrics course for some more specifics on how to take care of peds. Now go out and be your best selves today. And as always, happy nursing.